hands? They would totally, yeah, yeah. Okay, are we officially, see, Facebook likes to play around with me. It makes me think I'm live, and I'm not live. Am I live? Am I, okay, nope, I'm live. All right. Hey guys, good evening. Welcome. All right, I'm just setting stuff up here. All right. Guys, welcome to Cozy Talks. So we're going to give you guys a couple of minutes to jump on board. As you come on board, those of you who've been with me for a while, you know that I love to hear from my audience. Hey, Harvamsh, India, live from India. I am so glad that you're here with us this evening. Line, mujer, you must be in Georgia by now. Hello, Angela, thank you for coming on board. Guys, as you jump on board, hey, Carl, oh my gosh, you made it, thank you. All right, that's my boy from Miami right there. So guys, as you jump on board, don't be shy. Let me know who you are, where you're from, and what is in your coffee mug. We got to start off this night correctly. Lift up your mugs, folks. Cheers. Let me know if you've got coffee or hopefully something a little more interesting in your coffee mug this evening. And I have a very, very special guest with me today. And those of you who've been following me on my post this week will know who this gentleman is. Hey, Casey, Rhonda, I'm so glad you can make it. Bonnie, your prizes from last week are coming through in the mail soon. We've got Tom from Wichita, Kansas. Melanie, oh, thank you, Melanie. Johnny V. Johnny, that's not how you introduce yourself, man, when you come on the show. That's one of my cancer survivors right there. We've got Benny. Hey, Benny from Texas. Angela from Roan Mountain, Tennessee. And Rhonda from Columbia, Missouri. Thank you, guys, for letting me know. Don't be shy. So guys, we're going to let another minute coffee, all right? Jody, oh, Jody, your messages this week have been so beautiful. Thank you so much for all of your support. We've got Donna, Doug, and these comments are going by. Doug, I've been having way too good a time with the bob that you sent me. Did you see the latest one? Yeah, I took it there. Casey, originally from Riverview, now in not New York, North Carolina, drinking coffee. Damon, what's going on, man? Susan, oh, I'm so glad you're here. And Robin, that's my girl right there, Robin.
I'm
she
from
knows
Richmond.
you. Yes, she recognized your name. She's like, I know you must have been a resident. Maybe?
I went to medical school. I grew up in Richmond.
Well, so. There you go. She is.
Yeah. Oh, I know
wonderful,
Robin.
wonderful.
I know Robin. Yeah.
You know Robin? Oh yeah. My goodness. And then Kristen's here. Oh my gosh, I got a lot of great crew here. Jim in the hospital recovering from hip replacement. Jim, gotta let me know how you're doing, man. Stephen, thank you. Beer from Ireland. So there's my Irish. I'm waiting for my other Irish representative to come on board. Where's Bob? Bob's in timeout right now, so he behaved a little inappropriately in that last post. Helena, girl, can't wait to see you this weekend. Barbara, what's going on? Thank you for coming. And Kay, y'all are just popping on board. Oh, you got your t-shirt, Glenn. Good. Glenn, I want you to post a picture with your t-shirt. Hey, Carol, we're just going to give you guys a few more seconds to jump on. I know I have some new folks coming in tonight, so I want to make sure that they can find the link to the show. G, that's my brother-in-law. That's the best interventional radiologist I know right there, representing from Maryland. All right, guys. Woo! So, guys, let me know if you can hear me. And then Maggie, oh, and Shri with Alex. Oh, my gosh. So here, Dr. Kiluk, say hello to everybody. So
hey, everyone. I'm so excited to be a part of this.
All right, can you guys hear him okay? We're trying to make sure we follow all the rules as best we can. Still fighting with the RSD. Yeah, we'll talk a little bit more about that later, Angela. All right, guys. We are going to go ahead and get started. For those of you joining me for the first time, welcome to Cozy Talks. My name is Cozy Belloso. I'm a physical therapist, amputee specialist here in Tampa, Florida. I've been a PT now for over 17 years, and I have a private practice here that is exclusively for working with the limb loss community. Now, generally, the purpose of my show is to help inform, educate, and empower the limb loss community. But tonight I'm going to kind of deviate a little bit from the formula. Hey, Leslie, that's my sister from another mister right there. Hey, Rhonda, glad you're here. So, you know, this month is Breast Cancer Awareness Month. And it also happens to be National Physical Therapy Month, which I didn't know about. One of my viewers brought that to my attention. So thank you, Johnny, for letting me know. Dick Devers, I'm glad you're here tonight. So, you know, we're going to take it on a different note. 50% of my viewers are female. So this talk tonight will relate to you. And men, unfortunately, you're not off the hook for this one. Male breast cancer is a very real thing. Not to mention that all the men out there have a special woman in your life, whether it's a mother, a sister, a niece, a daughter, a friend, someone that you can help possibly with some of the information that you hear tonight. Raisa, mujer, hace tiempo que no te veo. Thank you for coming on board. Jerry, I haven't seen you in a long time. Thank you for coming. Oh, all right, guys. So I'm going to let Dr. Kiluk introduce himself, not myself. It's not often that you get to say that someone saved your life, and much less be able to thank that person. So that is who Dr. John Kiluk is for me.
So my name is John Kiluk. I'm a surgeon at Moffitt Cancer Center here in Tampa. I grew up in Virginia, and through a very interesting path with great mentorship, it kind of led me down to this road of taking care of people with breast cancer. I finished my training at Moffitt, and I just loved the hospital, and I had this wonderful opportunity to stay, and I've been working in Tampa now for about 13 years, taking care of breast cancer, and that's thousands upon thousands of patients, and I think it's the best job in the whole world, because I meet so many different people from so many different backgrounds, and it was interesting when I decided what I was going to do and go into breast cancer. Who's the first person you think I was going to call? If I knew this is what I'm going to do, who do you think I'm going to call first?
Oh gosh, your father.
Well, I called my mom.
Your mom.
I called
Your
mom.
parents.
And I said, Mom, I think I'm going to work with breast cancer. And what was funny is my mom said, well, why are you going to do that? And so this is typical mother-son dynamics. And I was like, Mom, what more do you want me to do with my life?
You slacker.
I'm taking care of women's cancer. Come on. And basically, so what's wrong? And she said, well, you're going to get bored. And I just start laughing at that point. I think, of all the thousands of patients I've seen over the years, I've never had two identical patients. Not only is every cancer different, but our treatments are different, and every person's different. What their priorities are, what their goals are, how they look at things. Like there are a million variables that go into this, and every situation is so different, and it really brings a lot of joy to my job. Is just meeting so many different people, and really meeting very remarkable people. I don't, I think a lot of you guys understand how cool this lady is, but she's really darn cool. And I've had lots of patients, but the way she can just handle something and go all in, she's really like very, very special. So you guys are very lucky to have her.
Thank you. Thank you. Looks like you got quite a few Virginians here on board this evening. And guys, I'm starting to see some of my fellow cancer survivors, and Dr. Kiluk and I were having this conversation before we went live. I have a lot of osteosarcoma survivors on my show. So if you're willing, I would love to hear from you. Those of you who have finished treatment, those of you who are going through treatment, give us a shout out tonight here in the comments section. So we're going to talk a little bit about breast cancer 101. And on my show, I like to say 101 a lot. The 101 on proprioception, the 101 on prosthetic feet. That's where I got it from. I stole his line. So that's how he spoke to my husband and I on our first visit with him. He said he was going to give us the breast cancer 101 talk. So we're going to go ahead and just get started with that. The information tonight that I'm going to be giving many of you have already heard this information. We have so much awareness now in our nation, which is a wonderful thing. But if you hear just even one new piece of information tonight, I feel like we'll have met our goal. If even hearing this information that you already know encourages you to get screenings done, to get that mammogram done, to get that biopsy done that somebody recommended that you do, then again, I'll have done my job tonight. And for those of you out there, I know I have some ladies out there listening who are currently going through treatment. And it wasn't too long ago that I went through my own, and the memory is still very fresh for me. And I know that during that time, I looked for sources of faith and hope. So if you can get a little bit of that tonight, then I know I will have earned my supper. All right, guys, let's just start with the basics. On the show, I like to bring it back to the basics. What is cancer? And this is kind of how I also explained it to my children when I was first diagnosed. In our bodies, we have heart cells, we have liver cells, we have bone cells, skin cells, all sorts of cells that every day are turning over. Our body is constantly making millions of new cells a day. Every once in a while, our bodies produce a mutant cell. That's kind of how I say it, because we love sci-fi here in my household. So it's a mutant cell. And for the most part, our immune system is able to identify this mutant cell and destroy it. But every once in a while, for reasons that science is still trying to research and figure out, the body's not able to identify that the mutant cell is present. And that mutant cell decides to multiply and make friends. And then it starts to invade the tissues, and that's when we call it cancer. Okay. So for the sake of tonight's talk, we're going to keep it simple, because cancer, okay, we're going to keep it simple, okay? I like to think of cancer in two main groups. We have our liquid cancers and we have our solid cancers. And our liquid cancers is exactly that, cancers of the fluid of the body. So cancers of the blood, bone marrow. These are your leukemias. These are your lymphomas. And then we have our solid cancers, and this is where our star of the show, breast cancer, falls into play. And it's exactly that. It is a solid mass. It is a tumor that has become cancerous in the body. And these can be found in the organs, on the bone. Breast cancer is another one, prostate cancer. So that's kind of how I like to kind of classify cancers. Am I getting this right so far? So far, so good?
You're good.
So far, so good. Guys, I'm nervous. I'm not usually nervous talking on the show, but I'm nervous. I'm all about the amputations. This whole cancer thing is, whoo, right? All right.
Because I'm intimidating.
I know. I know. You should see him with the medical students. It's awesome. It's awesome. I love it. All right, guys, should be known. Yes, and Jim, we are definitely going to be addressing in that, and that's when I'm going to punt the ball over to him to talk about male breast cancer, because yes, unfortunately, men are not off the hook for this, and when men get the breast cancer, it's pretty serious. And harsh, we're going to be going into that at what age men and women should start preventative checks. We're going to get to that, guys. We're going to get to that. Glenn here is one of our sarcoma survivors. Harsh, thank you so much. Angela, you want a cozy t-shirt? I want a cozy t-shirt too. I don't have t-shirts. I have really cool mugs though. That's it. T-shirts are next. Barbara is a clear cell sarcoma survivor. Barbara, you've been on the show so long. I love having you on the show. All right. William is testicular kidney cancer, 7-time cancer survivor. Wow. All right. Sorry, I love reading your comments here. All right. So let's go now to what is breast cancer. So breast cancer is a cancer that begins in the breast tissue. And once again, in medicine, it's never just that simple. There are so many different types of breast cancer. So the most common one that you hear about and accounts for 70 to 80% of cases is invasive ductal carcinoma, and that is the one that I had. So it's basically cancer of the ducts, so the plumbing in the breast where the milk comes through. That's the one that usually causes most of the breast cancers. So men, is this the one that men typically get as well?
Men usually have ductal as well.
The ductal carcinoma as well, okay? So what happens with the breast cancer is if it goes unchecked, it starts to grow and it spits out little friends, and its little friends go into the lymph nodes. I like to think of the lymph nodes as the subway station. And when the lymph nodes start having these cancer cells, then they start spreading it throughout the body, and that's where you start to see the metastases. So it's kind of like the New York subway system, right? Mm-hmm. Lymph nodes are your station. They hop there for a ride, and they go traveling throughout the body. In the terms of breast cancer loves the bone, the brain, the lungs, and the liver. And again, every cancer is different, so we're just covering the basics here tonight. So just some of the stats, and these are the stats that really get my attention, guys. In the United States, 1 out of 8 women will experience breast cancer in their lifetime. So think about this number, guys. Let's make it a really easy number, 24. It's safe to say that all of you out there know 24 women, whether they are women in your family, women in your community, you know 24 women. So according to these statistics, 3 of those women will have breast cancer. And that's just the breast cancer. That's not all the other cancers that are out there. It's pretty daunting statistics, guys. The general age range for breast cancer is typically 50, help me here, 55?
The average age for females that have breast cancer is about 60 years old.
Okay.
The average age for a male is about 70.
Okay, so a little bit older. A little bit older. And right now, according to the American Cancer Society, breast cancer is the 2nd leading cause of death in women in the United States. I thought it was going to be cardiac, heart related. And the number 1 being lung cancer.
Oh.
Lung cancer beat it out. So who gets breast cancer? Anybody. It could present in males and females, and we're going to talk a little bit more about that later. How am I doing?
Good.
We're doing okay?
Good.
All right. Let's talk a little bit about the risk factors. So there's two different kinds of risk factors. And again, guys, this is not a full list. I just picked some of the more common ones that I see and I hear about in the research and on the Cancer Society website. So there's lifestyle risk factors, meaning these are risk factors that are under our control. And then there's the non-lifestyle. Basically, you're born with it, nothing you can do about it. Sorry, toots. Okay? So some of the factors that you cannot change. Female. You know, obviously women have a higher risk than men for breast cancer. Getting older, and boy, I wish that was a risk factor I could control, but yeah, we can't. So your risk begins to increase for women after the age of 55 to 60. Okay? Apparently, between Caucasian and African American women have the higher risk right now, and Hispanic, Asian, and Native American women have a lower risk. So I guess my Cubana genes did not kick in for this one.
And you know, I just want to make one point is that, you know, we evaluate all these risk factors, but you know, I can't tell you how many people come see me and they say, listen, you know, I live a healthy lifestyle. I have 0 risk factors. No one in my family's had breast cancer. And they're still talking to me. So, you know, I think with a lot of things, you can't let your guard down. You know, this is stuff to be aware of. And even if we have every risk factor known to man, it doesn't mean you're going to get breast cancer. You know, but it just helps kind of predict. And, you know, I kind of, when I explain risk of cancer to patients, I kind of say it's kind of predicting the weather. Okay, we live in Florida right now. We know hurricanes can happen. And so, like, if you have a big family history because your mom had breast cancer or you name it, well, okay, we live in Florida, we have to be on guard, but it doesn't mean it's going to hit. But that being said, you know, we've all seen a hurricane hit New York, and we just go like, okay, this makes 0 sense.
Mm-hmm. And actually, we have a question if you want to go and answer this right now.
What is this?
Thoughts on genetic testing?
So genetic testing is great. That definitely is a huge way to estimate risk of developing any kind, different kinds of cancers, actually. If we do testing, it's really best done through a genetics counselor. Because there's so many different genes to look for, and so, you know, I'm a very firm believer the best person should do the job, and trust me, a genetic counselor knows much more genetics than I will ever know. Now, when it comes to gene testing, actually the best people to get tested are the people that have a known cancer. So, you know, just to get tested and there's no family history, that's probably going to be lower yield. If, let's just say, your sister had breast cancer, well, it's actually best to test your sister first. Because if someone in the family has that gene, it could be your sister. But, you know, I try to look at patterns in families. So, you know, if a lot of people have had breast cancer, if male breast cancer is in the family, that's a little rare. So that's a red flag to say, hey, you need to look into it from a breast cancer perspective. If ovarian cancer is in the family, that's a red flag for, hey, something may be going on. Namely the BRCA gene, which everyone understands from Angelina Jolie. So these are things to kind of think about, and you can talk to your medical professional about gene testing if there is a big family history.
Yeah, and I have to say that was probably one of the more fascinating parts for me as a clinician, being a patient, was going to see the genetic counselor in my personal case, and I'll tell a little bit more about my personal story a little bit later on in the show. But I had none of the risk factors. I was one of those women telling him, I'm fine, I've got nothing. I'm the anti-poster child for breast cancer. I actually had a 3% chance, so even lower than the average American woman, and no family history. So he's absolutely right. The genetic counselor told us I'm the one to be tested. And thankfully, in my own genetic testing, nothing came up. I did not have the BRCA gene, which meant that the other women in my family did not have to go on and be tested, and including my brother did not have to go on and be tested. So that was a nice.
But that being said, obviously everyone still has to be
Everyone
careful.
still has to be very careful.
Because we don't know what causes cancer, and
No.
so as a result, you know, it could be something we haven't discovered for another 30 years.
Yep.
So, you know, I think we always have to be aware and careful. Now I saw one comment about, well, what if you don't have a genetic history? I see patients that maybe were adopted and they just really don't have any history. And it just kind of depends on their scenario, whether we test them or not. And so, especially if I'm talking to a young patient with breast cancer, I definitely would do gene testing, and we do just test for everything, to be honest, just to be sure. But if you're adopted and you don't have cancer, don't have problems, I don't know if it's necessary. You need to do testing at that point.
Okay. So let's just talk a little bit. We talked a little bit about the risk factors that you have no control over, but these are the lifestyle factors include increased alcohol intake. Sorry, ladies. Obesity after menopause, not being physically active. Women who have their first child after the age of 30. Women who do not experience a pregnancy. Not breastfeeding. Using hormonal birth control, and using certain kinds of hormone therapy after menopause. And guys, this is not a judgment call on how people live their lives. These are simply certain trends that research has shown that associates with an increased risk for breast cancer. Are there any other risk factors that I may have missed that you think we should?
Well, there's some menopausal, or there's certain estrogen risk factors. So early late menopause.
Thank you.
Late first childbirth. The way I easily remember all these things is increased cycles.
Mm-hmm.
So kind of like the more cycles a lady has may put her at a little bit increased risk. Obviously, any personal history of having any abnormalities with her breasts, like maybe an abnormal biopsy, or obviously personal history of cancer puts her at increased risk. The other thing that is a huge risk factor for breast cancer is actually history of lymphoma. This is a less known history in that certain lymphoma patients get treated with radiation in their chests. We call that mantle radiation. And so what we've found is that really increases the risk of maybe developing a breast cancer. And I've had several patients that have a history of lymphoma, and we have to be very aggressive with their treatment of breast cancer as a result.
Wow, so they kicked lymphoma and now they're dealing with breast cancer.
Mm-hmm.
Wow. All right, guys, let's just talk about some of the common signs and symptoms. The most obvious one being finding a lump in the breast. Now, and I'll tell more about my own story, but women get lumps and bumps, especially as they get older. Some women get lots of lump and bumps in their breasts, and some women don't get any. For the most part, they tend to be benign, and it's just part of the normal as the woman goes through her cycle, and then it'll happen. Obviously, any lumps and bumps need to be checked out and need to be screened first by the OBGYN and further on if need be. Other signs and symptoms is swelling in all or a part of the breast, even if there is no lump present. Skin dimpling, and this is one that I had a lot of my breast cancer friends, that this is their symptom that they presented with, that their skin took on that orange peel kind of texture. Not at all muffled. Oh, okay, sorry. I was reading one of the comments from Tom there. Pain in the breast or in the nipple turning inward. The skin changing on the breast where it becomes dry, flaky, or thickened. If there is discharge, if there are swollen lymph nodes, particularly near the collarbone or in the axilla under the armpit. So these are just some of the more common signs and symptoms. I know I missed some.
Well, no, you got them all. I think a more simpler way of looking at this is that I am a very firm believer that the patient is the best doctor always. No one knows your body better than you. And this goes not just for a lump in your breast. This goes, if you're looking at a mole on your arm, how you digest food. This goes for everything. And so, unfortunately, in this world, you have to be an advocate for yourself. And what I'm looking for from a patient perspective is changes. So when a patient comes to me and says, "Hey, my breast has never done this before." Now with some patients, they have these changes to their breast that are kind of normal changes, but just when things aren't like they ever have, that's when you need to seek medical advice. And sometimes patients come in with, hey, my breast's never done this. We work it up. It's normal. Good. We like that. That's a very easy visit. But that being said, I can't tell you how many patients I've encountered that have found their own cancer. And once again, this goes for anything.
Oh, Jody, you're going to find out how I found such a great doctor. That's a good story. And guys, if the whole patient advocacy sounds familiar, he's definitely been a huge influence for me there.
And just as a side note, I did see one comment about a PALB2 mutation. Okay. You definitely should talk to a specialist and go over how we would manage that. And really, we do recommend either aggressive screening or consideration of prophylactic surgery, but it really should be done with your provider. And I don't know a whole lot of details with you, so I don't want to get into all that.
Okay, thank you. And then, okay, you're back in, Maggie? Good. Okay. So let's talk a little bit about the treatment for breast cancer or cancers in general. And again, this is just my simplified way of looking at things. You're either looking at localized treatment or systemic treatment. Localized meaning if the tumor has stayed in its place, it hasn't spread wings, it hasn't sent off little mutant cells all across the body, and it can be treated locally with either radiation, with surgical management and removal. Now, once the cancer has spread, then you have to throw the big guns at it with systemic therapies such as chemotherapy, immunotherapy, and this is where I'm definitely passing the mic on to you.
Well, so I love analogies when I talk to my patients, and by far my favorite analogy to explain breast cancer is the animal in the cave. So a lot of times, someone will get their mammogram or they feel something and they'll say, there's something in that cave. Well, what do? You shine a flashlight in that cave to see what's going on. So we do a needle biopsy. And if it comes back benign, the cave's empty, everyone's happy. But every so often, you look in that cave with a needle biopsy and it shows there's an animal in there. Now the first question that a patient would have is, well, how big is that darn thing? What do we need to do? And so that's why we may do additional scans and kind of get an idea, do an MRI, do ultrasounds to get a better idea of what's going on. Now, if the animal appears to be on the smaller side, well, the next step is, okay, I grab my sword and let's go get this thing. And we do surgery to get the animal. And basically, not only are we getting the animal, but we're walking to that cave to know exactly how big that thing is. We do the best we can from the outside of the cave, but as you guys can imagine, you walk in that cave and there can be more than meets the eye. And so a lot of it we're trying to figure out what's going on. And based on how big the animal is, that will guide, okay, do you need to pull out this big bazooka called chemotherapy? Or do we need to do other things? Now, there are times in my job when the patient's meeting me for the first time, I'm shining up my flashlight in that cave and I say, oh, that's a pretty big animal. And so in situations when I know this is going to be a tough animal to fight, what we actually do is we take grenades and throw the grenades in the cave first, basically blow it up. Then we walk in with our sword. And so this is a very simplistic way of explaining the rationale of our treatments, and we just go from there. PET scan for treatment of 1A, usually we don't get PET scans for stage 1 breast cancers. Usually those are very friendly and with good prognosis.
Mm-hmm. You sound like a Marine. My dad would be so proud. Throw the grenades in, and then come in and get the rest of them. So guys, I remember that analogy, and that's an analogy my husband and I have stolen from him to explain. I know you need to get copyright on some of these things. So, let's talk a little bit about male breast cancer, and this one really doesn't get a whole lot of attention, and it should. You're not off the hook, man. And again, I'll admit, I really don't know much about it, other than it's more serious sometimes than when the women get it. That's all I know.
So, male breast cancer is a lot rarer than female breast cancer. We talked about 1 in 8 women can get breast cancer. It's actually about 1 in 1,000 guys. There are about 270,000 cases in the United States in female breast cancer, about 3,000 guys. So it's a pretty rare cancer. Now, I think probably the biggest thing that about male breast cancer that I take note of is that a lot of people don't even realize that guys can get breast cancer. And that goes not just from a patient perspective, but from a medical perspective. And so what can happen is that guys can present at a lot later stages. If you think about if a lady has the smallest little bump in her breast, she's breaking down to the door of the hospital. Guys can be stupid. I can say that. And oh, it's nothing. And they may go see their doctor and say, oh, it's just a cyst. Don't worry about it. And you can see how that can go along. And so, unfortunately, I've seen pretty far advanced male breast cancer. And I think the key to cancer is trying to catch it as early as possible. Trust me, no one wants a bazooka. No one wants, people just want their life back to normal as quickly as possible. And the idea is the earlier you catch things, the better we do. I think the most important thing about breast cancer that you guys please need to understand is that if you look at the history of breast cancer, mortality, how people were dying, was going up and up and up until about 1990. And ever since 1990, that curve actually went over, and now it's going down. And so the question is what the heck happened in 1990 that made this really big bend in the curve on mortality from breast cancer? And really the answer is very simple. That's when you start seeing the pink ribbons. That's why we're kind of dressed in pink. That's when people start getting in your face and saying, get a mammogram. And really, I don't know what more proof you need than that to say, about awareness and taking care of your body. And the idea is the earlier you catch it, well, maybe you won't need to have chemotherapy. Maybe you won't have to have your breast removed. Maybe you don't have all your lymph nodes removed and have your arms swell. There's a lot of, this can really affect your quality of life, and the earlier you catch it, the less impact it's going to have and get you back to living life as quickly as possible.
Gerard, you're absolutely right. I have amazing academic oncology care. Dr. Kiluk doesn't know yet, but he's not allowed to retire. That's just, sorry. Actually, great question, Gerard. What do rural patients need to ask for regarding treatments and surveillance?
Well, I think, first off, the big thing, the biggest part is screening. Mm-hmm. So if you don't have anything, not only do you monitor yourself for changes, but, as a standard rule, I think that all women should probably start getting mammograms at age 40 and go every year. Okay, now you can dial that up, dial that down according to risk. Mm-hmm. I think one thing, the biggest risk factor in my mind is family history. Mm-hmm. So if your sister had breast cancer age 35, don't wait till you're 40. Okay? You really need to, once again, speak to your medical provider about maybe starting screening a little earlier. Okay? And there's so many different variables to this. As far as, rural settings, well, what I'll say is there are good doctors everywhere, there are bad doctors everywhere. Whether you're rural or urban or this and that, find a good doctor that you can talk to. And if they're not giving you the answers you need, find someone else. And obviously in the rural area, you may have to drive a little bit. As far as guys get mammograms, we usually do not do screening mammograms on guys. What's interesting is even if the man has a gene, the risk for breast cancer is lower than the average female.
Oh, geez. Y'all, really?
So we don't generally do that. Now on my men who have a history of breast cancer, I will get a mammogram on their other breast just for surveillance because they've already had it once, and that's a pretty big risk factor from my perspective. Sure.
Okay. So he went ahead and answered the next question I was going to ask is when do you start having screenings? And there's one thing I want to bring up because, and I call this, I credit this to Dr. Google. If you were to Dr. Google your paper cut, it would come back that you have cancer. If you look at all the risk factors associated with breast cancer, you can probably pick out one or two that are present in your own life. And it all boils back to communication. And he said it. I know I beat that dead horse on this show all the time. Communication with your medical team. I'm constantly advocating for my amputees, my diabetics, my vascular patients to constantly communicate with their doctors to keep their medical status in check. When it comes to breast cancer, women, talk to your doctors, specifically your OBGYN. They're kind of the front runners. They're the gatekeepers right there for helping catch this disease. Sometimes women don't know who it is that they're supposed to go to. And I've gotten several phone calls in the past 4 years of, Kosi, I found something. Who do I go talk to? Me personally, I like to tell people, go talk to your OBGYN, because if hopefully, most of you women are going on a yearly basis for your women checkup. So you already have a relationship with this particular physician. This physician hopefully knows you. And like Dr. Kiluk said, they can help you interpret the changes that you are possibly seeing with your own body. Celia. Guys, those of you who saw my neon blue wig picture, I got a lot of great feedback from that. That's the lady responsible. I'm going to put her on the spot tonight. She showed up when I was completely miserable in my second round of chemotherapy, and she brought me this amazing neon blue wig, which I wore to church. That was fun. Anyways, so getting back to it, and ladies, he stated it perfectly. If you think something is there, get it checked out. It's better for the doctor to tell you, no, you're fine, than for you just to keep holding on to it. And I can't say enough about self-breast exams, guys. We know our bodies the best. So we know if something changes. And sometimes I've heard just as many women tell me that they found the lump before the mammogram, and just as many women tell me that the mammogram was the first to find the lump. So do both. I guess what it boils down to.
And from a doctor perspective,
yes.
I've never been mad at a patient for calling me.
Mm-hmm.
On the other end of the spectrum, I've been very mad at a patient for not calling me.
Mm-hmm.
Because how can I help you if I don't know there's a problem? And all I can say is if the doctor has a hard time with that, well, you find a different doctor.
Is this sounding familiar, folks? Remember how I talked to you? How do you find your clinician? How do you find the clinician that's going to help you when they say something like that? When they want you to call them. And this is probably one of the busiest people I know. And guys, I got 4 kids, 2 businesses I'm running. He runs circles around me with how busy he is. But I know that if I call and I leave a message, someone's calling me back right away. And that's what you need. You need an open line of communication and a doctor who wants you to ask them the questions. All right, guys, let me just see. Emily says, sitting next to my mother-in-law who just had her 4-year clean bill of health from breast cancer yesterday. Felicidades. Congratulations. That is definitely something to celebrate. All right, I'm just kind of screening through here to make sure we picked up all the questions. So guys, several times on my show, I bring on special guests and I ask them to tell their stories through limb loss. And we've had some incredible stories of trauma and obstacles and recovery and success. And I know that when my guests are sharing their stories on the show, they are really going out of their comfort zone. So I figured turnaround is fair play. So I'm going to tell a little bit about my own story tonight. And those of you who've gotten to know me a little bit know that I am actually a very private person. Despite everything I do on social media, it's geared more towards my work with the limb loss community. But I figured if my guests can come out of their comfort zone, so can I. And like I said, if any of my story or any of the information that Dr. Kiluk we shared tonight prompts you and encourages you to either get tested or to give the nudge to that loved one that you know needs to get tested or screened, then it will have been worth it. Theo, we're going to pick up that question because that's a great question. Is it always good to get a second opinion about treatment options, and do they vary that much?
Well, so that's hard for me to answer that question about how much treatment options vary. Because I have seen variations in treatments. Now that being said, once again, you remember how I said that the patient's the best doctor? I think it's so important to have good communication with your team. And being a patient sucks. Everyone on this knows that. And I think really the reason why being a patient sucks is that it involves so much trust. You have to trust this person all the way. And so I'm a very firm believer in the voices in your head, okay? Meaning, there's that voice in the back of your head that tells you what to do. I rely on this all this time as a doctor where I'm like, okay, how should I treat this patient? And the voice is saying this, and for whatever reason, it guides me, and it's always right. And this goes for life too. What should we eat tonight? And okay, it just makes the right choices for you. And so, I really, if I'm thinking about a patient, is trust your instincts. That, if you're meeting a doctor and you're getting great answers and they're being responsive and it sounds legit, I don't necessarily think you have to have a second opinion. On the other end of the spectrum, if you are, you want, you're a little nervous about something, you're just not sure, I have nothing wrong with second opinions. I think the more opinions, the better. But that's a very personalized thing.
Mm-hmm. Absolutely. I just saw that message from Emily. Emily, I always love hearing from another physical therapist, especially a local one in a lymphedema and who used to work at Moffitt Cancer Center, where Dr. Kiluk works, where I received my treatment. Emily, I would love it if you would send me a message after the show is over, and I'd love to connect with you. Shri, thank you so much for posting that. I think that's awesome. A monthly text reminder for doing self-breast exams. Wonderful. All right, guys. So here goes, right? Here goes the story. So, good gravy. November 2015. It was the week before Thanksgiving, and I found a lump. And I usually have a visual here. It was the size of a black bean. I'm Cuban, so I gotta use the black bean reference. And it felt like a black bean. It was just this hard little lump that was sitting right here next to my sternum, my breastbone. And I was in my mid-30s. I was very young. At the time, my kids were 9 years old, 7, 5, and 2 years old. So I had just finally started sleeping through the night after that fourth baby. So I found the lump, and I thought, it's about that age where women start, getting lumps and bumps. I have no family history. I have none of the risk factors that we talked about tonight. So I did what all intelligent clinicians do when they find something on themselves, and I ignored it. Stupid. Yeah. He's like, oh, why did you do that? Okay. So I ignored it for, give me some credit. I ignored it for only 3 days. So after 3 days, I'm sitting next to my husband watching TV, and I just look at him and I go, hey babe, I found a lump. And my husband is also in healthcare, and he doesn't get his feathers ruffled easily either. But he was the smart one of the two of us. He's the brains of the bunch. And he said, go get it checked out. He goes, it's your first lump that you're finding. Just get it checked out. Okay, fine. Guys, at this time I was working home health, raising 4 kids, 9 and under. The last thing I needed to do was make another appointment for myself, but I did. And I went to go see my OBGYN, who is a woman that is just an amazing woman. And she immediately sent me to get a mammogram and an ultrasound. Hey, Tisha, so glad you could join us just in time. So here I am grumbling because I'm just like, I don't have time to go out of my schedule and figure out who's going to watch my kids while I go and get this dumb mammogram. I had had a mammogram done earlier that year, which was clean. So I make the appointment, I get the mammogram, I get the ultrasound. Now, any of you who have had any kind of ultrasound done, it's that lovely dark room, and the ultrasound tech, they must be the best poker players because they all have that flat affect. They give you nothing. And the tech is doing the ultrasound, and I'm starting to get a little nervous because, again, tech has given me nothing. So the tech leaves the room, and in comes the radiologist. And I'm sitting there going, oh, crap. And the radiologist was actually a very kind human being, and he said, it was a slow day today, and I know you were a little nervous, so I went ahead and read your mammogram and your ultrasound, and you're fine. He goes, you're clean. He goes, you do have something there. It's not a cyst. It is a solid little lump. He goes, but then he went on to explain, this is just one of those kind of lumps that it's just a fibroma, just a little lump of tissue. And he said, come back in 6 months, and if it's getting bigger and it's bothering you, then maybe you can get referred to a surgeon to get it removed. But other than that, you're good. Awesome. Go out to the parking lot, call my husband, babe, I'm good. I need to go back to work so I can finish my documentation on my patients. And then I call my dad. And my dad, at the time, was working at Moffitt Cancer Center. And I said, hey, Dad, got the results from the radiologist. We're good. We're in the clear. You coming over tonight to babysit the kids so I can go out with my husband? And my dad says, I made you an appointment with my buddy, John Kiluk. And I'm like, what? And I'm sitting there arguing in the parking lot with my father. I'm a grown woman with 4 kids arguing with my father. And he's saying, just go in and talk to him. And I was like, Dad, I don't want to waste this man's time. I just got cleared by the radiologist. It's nothing. We're fine. I have no history. Then fine, Dad. I'll go see Dr. John Kiluk. So I go see Dr. John Kiluk, and he recommends a biopsy. Denial is a really powerful tool, guys, because this whole time, I respect Dr. Kiluk, as if my father respects Dr. Kiluk, that says something about Dr. Kiluk, and those of you who know my father know that. But this whole time I'm thinking, I'm kind of internally rolling my eyes going, great, another appointment I have to make. Great, now I have a biopsy, which means I can't go running after a couple of days after that, and then I can't lift anything. So I go and I get the biopsy done the Monday after Thanksgiving. It's kind of funny how these dates, certain dates just kind of stick out in your head. And then 3 days later, it's Thursday night, December 4th at 8 p.m. And I'm driving in the car with Charlie. She's my second daughter. She's 7 years old at the time. And we're actually going to a play rehearsal. I'm the lead female role in this play that I really wanted to do for a long time. And I always brought a child with me so they could be with me during rehearsal. And I get a phone call. And it's Dr. Kiluk. And I'm thinking, oh, how nice. He's calling to tell me that, my results are negative because he knows that I just want to get on with my life and not have to deal with this anymore. Denial. Big, 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 big thing. And he starts talking on the phone, and he starts talking about abnormal cells. And again, I'm thinking, great, the radiologist botched up the biopsy, now I gotta go do another one. And it wasn't until he said the word cancer. And those of you out there who are cancer survivors, I know that you can recall with equal clarity the moment that your doctor told you you have cancer. And at this point, guys, this voice started coming out of my mouth that I didn't recognize. And it was a hysterical voice, and it was a spectacularly melting down, nervous breakdown type voice. And poor Dr. Kiluk is trying to calm me down on the phone. And he's telling me, I'm going to call your father, I'm going to call your husband, can you get yourself home safely? And then I hear this tiny little voice. Mommy, are you okay? Completely. Thankfully, I parked, because if not, this would have been a much different story. And it was my daughter. It was like an ice bucket of cold water just got thrown on me, and that horrible voice stopped, and I snapped back to reality. And I said, no, Mommy's okay. Mommy, we're just going to go home. Just wait in the car for a moment. I got to go talk to my director. So I was like, okay, I'm going to walk into the theater. I'm going to tell the director I have a family emergency, and I'm going to leave. I'm not going to say anything else. That's all I'm going to do. Walk in. The whole cast just stops what they're doing because I'm late, and they just all look at me. And again, this voice comes out of my mouth. This hysterical, crazy voice saying, oh my God, I have cancer, I have cancer. Oh my God, they just told me I have cancer. And in the meantime, this cast, they don't know me, so they think I'm doing some sort of acting, crazy woman technique. But this is where I saw another angel that God put for me. The director, she knew me personally. So she knew this was not acting. And she had just finished treatment for ovarian cancer herself. So she basically tackled me. This tiny little woman, 5'1", she just tackles me and holds me until I calm down. And she and her husband get my daughter and I home safely. And that night, I get home, my husband immediately whisks my daughter away to put her to bed, and my dad is standing in the driveway. And, you know, I'm a mess, and my dad is just holding me. And the only thing he can say to me is, trust in God. And I can tell that he was obviously having a hard time. That was probably the worst night of my life. And there are three things that got me through that night. My faith, my husband, my mother, and my father who were with me that whole night. And what this guy said to me. When he was telling me the news, he said, this was a Thursday evening, and he said, I am clearing my afternoon schedule. You are going to be my last patient tomorrow, Friday afternoon. Get your butt in my office. He didn't say it that way, but basically he said, get to my office Friday afternoon. And folks, he didn't have to do that. He could have easily told me I'll see you first thing Monday morning. And Friday afternoons, nobody wants to be at work on a Friday afternoon, especially not with a brand new cancer patient who's wigging out on the phone. But he already understood, and he knew that leaving me a full weekend to myself and my thoughts would have probably sent me to the loony bin. And he met with me. Oh, yes, Glenn, he's amazing. He is amazing. So guys, that Friday that we had our first talk, we didn't know anything about my cancer. We knew that it was breast cancer, and we knew one other detail. We didn't know if there were any other tumors. We didn't know if it had spread. We didn't know what kind of surgery, if I was going to need chemotherapy, radiation. We knew nothing. But when my husband and I left that appointment on Friday afternoon, we both had peace. Because I knew that I had the person that I could trust. And if you all wonder why I am so driven on this show for telling you all to find the prosthetist, find the physical therapist, find the surgeon that is going to be vested in your care, it comes directly from this experience that I had to go through. So several weeks went by, and lots of testing and lots of scheduling and lots more testing. And it was determined, the only thing we really knew was that I had another tumor. The MRI showed that I had another tumor. And so far we didn't think it had spread, but we weren't sure. We thought it was stage 1. And we thought that maybe, just maybe, since I was doing very aggressive surgery, maybe we could get away without chemo. Awesome. So I had my first of 3-4 surgeries in January of 2016. And the one thing, I don't know if you remember this, you have so many patients. I remember waking up in the recovery room, and he had waited for me to wake up to tell me that my lymph nodes were clean. And guys, those of you who are cancer patients, you understand how big that is. If your lymph nodes are clean, if those cancer cells are not sitting on that subway station, that means they have not traveled to your body, the rest of your body. So the surgeries were actually fine. They weren't fine, they were difficult, but for me as a physical therapist treating post-op over and over and over and over again for years, this was my wheelhouse. This is the part where I felt strong. This is the part where I felt confident in fighting this disease. And this is where I felt good. So as Dr. Kiluk said, when there's cancer, there's a ton of genetic testing. There's genetic testing on the patient. There's genetic testing on the tumor. That tumor traveled, I don't know how many different parts of the United States. It's traveled more places than I've traveled for all the testing. And then we had another little hiccup. So this whole time after surgery and recuperating from surgery, we're thinking, whew, we did the most aggressive surgery possible. We got good margins. Nothing's in the lymph nodes. Maybe we're not going to have to do chemo. Pretty much not going to have to do it. And then I get another phone call from Dr. Kiluk. I need to stop picking up the phone when you call. That's the problem. No, I'm kidding. And he says, well, one of your tests came back, and I just want to give you a heads up. You may very well have to do chemo. And not because we think that it's spread anywhere in your body, but because the way this particular little tumor is behaving, there's a very high chance of recurrence. And this is something you're going to have to obviously now discuss with the oncologist and make those decisions. So guys, up until that point, dealing with cancer, the diagnosis, I had a lot of fear, I had a lot of anxiety, I had some despair, I had nervous doubts. But this was the first time I got angry. for me, this, despite the fact that I had been through aggressive surgeries, this is where it really got real for me. They were thinking of putting poison into my veins, okay, to make sure that a cancer didn't come back and take me away from my children. And I was angry at the cancer. I was angry at God. I was angry at the radiologist who originally told me that I was fine. I was angry and I thought it was all unfair. So chemo came and went. I did several cycles of chemo. And as many of you have seen already from the pictures I've been posting this week, went through the whole 9 yards. Hair loss, basically being, I was social distancing before it became a thing. Social distancing from my friends, social distancing from my children, which was very, very difficult. As you can imagine, with young children, they just wanted to be on top of mommy. I had to exit stage left from my life for that time during chemo. I couldn't see patients, my counts were too low, but I finished. And I finished chemo in April of 2016 and rang that bell. And this is the part that I have spoken a little bit about on the show. When I rang that bell, I thought I was going to have a 500-pound weight lifted off my shoulders, right? Chemo's done, surgery's done, I've got a couple more surgeries to do, but that's good. I'm a PT. I got this. Didn't happen, guys. Didn't happen. And I think a large part of that, I know for me, it was the realization that cancer was going to forever be a part of my life. That no matter how many years went by, that little dark cloud was always going to be there in some way, shape, or form. And this was around the time also that Olivia Newton-John was going through her recurrence, and she had the exact same cancer as I did at the exact same age with the exact same treatments. And it was that realization of, oh man, my life will never be the same. I am not the same person I was 1 year ago, and I will never be that person again. And I need to figure out what my life is going to look like from now on. And I share this with you, and I've shared this on the show a few times because many of my patients who've lost a limb, going through that realization that their lives will never be the same. And this applies to any of the big traumas, the physical traumas anyways, to the body, whether it's spinal cord injury and being wheelchair bound, burn victims. I would see this when I worked in the burn trauma center, severe burn victims. It's that moment when you realize there is no going back from this. And you have to make the decision to play the hand you're dealt or fold. And that's it. So I'm going to leave you guys with one more story, and I was able to get through this without completely blubbering, so I think I'll try to risk this story because this one's probably going to make me start blubbering. A lot of times people will ask me, do you ever feel like it was unfair? You know, you were 35, 36-year-old when you were diagnosed. You had 4 young children. You were a clinician. You know, do you ever have that sense of feeling like it wasn't fair? And the answer is yes, of course. I'm human. But I always think back to this one young child that I know. About 2 years ago in our church community, a beautiful young girl was diagnosed with leukemia, and she was 9 at the time. And I'm friends with her parents, and her children are raised with my children. We all go to the same school and church. And because of what I went through, the mom approached me and asked if I would talk to her daughter because her daughter was learning about how she was going to lose her hair, how she was going to go through these treatments. I said, of course. So I go to the hospital and I start talking to this little girl, and she's a bright young thing. I mean, she's as smart as a whip. And I show her the pictures of me losing my hair. I show her the blue wig. We have a good laugh about it. I show her how she can style the scarves, all that kind of fun stuff. And I'm thinking, okay, she's doing great. She's doing great. Then she turns to me and asks me, why did this happen to me? And I'm sitting there going, oh dear heavens, why did she ask me this question? Why couldn't she have asked her mother who's sitting right behind me? And God sent me a little, clarity moment there. And I said, well, your father likes to run marathons, right? And she said, yep. And I go, okay. So what does your daddy do to prepare for these marathons? She goes, well, he goes out and he runs every day and he trains really hard and he works really hard. And I go, does he always want to do it? And she goes, no, sometimes he doesn't want to. And I go, well, what happens if he doesn't go in his training? And she says, well, he doesn't get to finish the marathon and he doesn't get the prize and the donuts at the end. And I said, okay. And I said, well, you and I both know that God has a purpose for everyone and he has a special plan for all of us, right? And she's like, yep, Bible tells me so. Good girl. All right. And then she just stops and looks at me and she says, this is my training, isn't it? Guys, I'm not making this up. I'm not making this up. This 9-year-old understood in less than 5 minutes what I still struggle sometimes to accept. And she said, I have to go through this training for whatever God wants me to do later in my life.
Mic drop.
Mic drop. You know, her parents are sitting there, and I'm sitting there going, right, out of the mouths of babes. That's how I deal with it. Because I want to think that there is a purpose for what I had to go through. I can't say that I'm glad I got cancer. I'm not there yet. I don't know if I'll ever will be there, especially every time I see a picture of myself without hair. But I do see what I have done in my life because of cancer. Opening up my clinic and doing this show is one of those things. I don't know if this is my final purpose in life or my final destiny or my final, but I don't think God's done with me yet. So that's how I make sense of it. And that's all I have to say about that. So guys, usually on the show I say at the end, thank you for letting me be a part of your lives this evening. But tonight I want to say thank you for being a part of my life. Thank you for all the overwhelming support that you have sent this week with your messages and your kind words. It is truly humbling. And I will never be able to thank enough this amazing man sitting next to me, along with my darling husband and my children who are listening right now, and my parents and my family, and all of the friends. And also Moffitt Cancer Center. So I got to get my plug out to Moffitt Cancer Center. So thank you guys. All right, guys, we're going to wrap it up for now. Have a wonderful evening. I will see you all next week. Same bat time, same bat channel.